selective food and drink. Highs that make you feel sick, lows that make you feel like you're going to die. This is the day in the life of a diabetic. Diabetes or diabetes mellitus is described as a group of metabolic diseases that causes high blood sugar, either because insulin produced in the body is not recognized, or maybe your body just does not produce insulin at all. Sometimes a person experiences both of these issues. Diabetes has been around, it seems, forever. The name stems from the Greek language. It means siphon. The name Diabanian came about when a Greek physician named Cappadocian referred to his patients that were passing much water as being like a siphon. The name diabetes was adopted by the English. Thomas Willis added the term mellitus in the year 1675. Mel in Latin means honey, and he claimed the person suffering from this condition had urine that was sweet. In China, they used ants to see if a person had diabetes. They claimed that the ants would be attracted to the urine expressed. This disease has also been called the sweet urine disease. There are 3 different types of diabetes. Type 1 is when a person has this type, their body does not produce any insulin. A person with this type will be insulin dependent, and it can have an early onset, such as in their teenage or adulthood years. This type is less common than the rest. Only about 10% of people with this disease has this type. People that experience this type of diabetes will need to take insulin injections from onset to death. Type 2 diabetes is when a person does not produce enough insulin for their body, or their body ignores what insulin it does produce. About 90% of people who have diabetes have this type. People that have type 2 diabetes may be able to control it by monitoring their blood glucose levels and taking oral medication. Type 2 diabetes is a progressive disease, and it usually gets worse. The third type is gestational diabetes. This is the type that involves pregnant women. Most pregnant women can monitor and control this disease with just medication and exercise, or change of diet. Undiagnosed gestational diabetes can also cause babies to be extremely large. According to scientists at the National Institutes of Health in Harvard, they have found that women with diets and high cholesterol have a higher risk of gestational diabetes. People who have diabetes do not always know right away. Things to watch for are frequent urination, excessive thirst, weight gain or weight loss, blurred vision, bruises and scratches that do not heal easily, and numbness in hands and feet. This is only to name a few. Frequent urination happens with this disease because the kidneys cannot filter glucose, and your body is not recognizing or producing the insulin that is needed. The kidneys take water from your blood in an attempt to water down glucose, which makes more frequent urination necessary. Excessive thirst happens because you're urinating more and your body is trying to compensate for that and for the lost fluid. Weight gain and loss happens because your body is either not making enough insulin, and in turn it seeks out other energy sources, which causes fat and muscle to be broken down to be used as energy. Blurred vision can occur because the tissue is being pulled away from your lenses, which in turn affects your ability to focus. Prolonged vision issues and blindness have occurred. Bruises and scratches don't heal as normal. This is because there is more sugar in the body, and the ability to conduct the healing process is undermined. Numbness in hands and feet occur with this disease because nerves can become damaged, as well as the blood vessels that feed those nerves. A person looking to get tested for diabetes only needs to provide some urine or blood to their healthcare professional. It really is an easy process to diagnose. There are many things that need to be done once diagnosed with this disease. Your doctor will test your blood every 3 months, and whatever medical treatment you are assigned to, they will ensure that it is working. You'll need to watch your diet and exercise regularly. There are some severe conditions that come along with diabetes that is not treated well. Conditions such as complications with the eyes, feet, and skin, heart problems, hypertension, and hearing loss. Mental health can be affected as well, as one can develop conditions such as gastroparesis, ketoacidosis, and neuropathy. Gastroparesis is defined as delayed gastric emptying. It's considered a paralysis of the stomach, and food stays in the stomach longer than it is supposed to. Ketoacidosis is where the body starts producing acidic ketone bodies, and neuropathy is when one or more of the peripheral nerves are damaged or dysfunctional. Statistics on diabetes show that 18.8 million people have diabetes, and about 7 million have it and do not know. This is a catastrophic number, and it can be changed with knowledge and determination. I myself have this disease and suffer from many of these issues mentioned. I also suffer from weakness and being overly tired and nauseous. If you experience any of these symptoms, please get yourself checked out. It could mean your life.